Thank you for calling Dental ABC. This is Christina. How can I help you smile today?
We've all done it or heard of it, dental scripting. Whether it's in the practice that you're in or in a course that you've taken, dental scripting is commonly recommended. But could it be inhibiting the relationship building between you and your patients and outwardly thinking?
At the Dental MVP, we use science to teach people skills to you, the dental professionals. Do not forget to subscribe to our channel, the Dental MVP, and don't forget to hit the bell so you never miss out. Okay, Chastity, the world wants to know, why do we do scripting in dentistry?
That's a good question. Well, results are in. And the reason we tend to script as well, because it's stuff. We forget stuff. And I know it's not a 4-letter word, but we forget stuff. And to be honest, scripting is a great way to be able to train new team members too, and what you're looking for, what you need to ask for, or being able to calibrate existing team members as well.
All jokes aside, it's true. We kind of need some sort of scripting or format to follow in the dental industry. It's hard to remember everything. We've got some weird language, and not everyone comes from a dental background when they're working at the front desk or even when they're assisting and working in the back. There's lots of moving pieces and parts, and you want to ensure that we don't drop the ball. The margin for error is pretty darn high in the dental industry, and the cost of that error is even higher. If we forget to tell a patient that they're going to have a copay at their appointment, who pays for that? The reality is that margin of error is something that we don't want to have happen. And if scripting can help us, that's what we're going to utilize it for.
I know, it's confusing. So we're saying that there are a lot of great benefits, but it's not successful. Well, we teach people skills. So when we're talking about scripting not being successful, we're telling you to throw away the scripts. It's not because we don't see a degree of value, but we find that when you have that list and that script that is there right in front of you, it eliminates your ability to be more outwardly thinking, to be more patient-centric or person-centric, to be empathetic and aware of what's going on with them.
Just think about the list in general. If you have a grocery list, for instance, and you're going to the grocery store, we are following that list to a T. And typically then we forget something because it wasn't on the list, right? How often do you get home and you go, oh, it wasn't on the list? It's really important to make sure that we are much more aware of all of our surroundings. We need to be aware of the person in front of us and not the piece of paper that's in front of us, or trying to remember the words exactly the way that I was taught so that I don't miss a beat. Too often, someone's going to talk to you and they might kind of skip over some of that you have listed down. And if they skip over on the list, then you're going to fumble. You're not going to feel like you're very confident or being truly authentic, really involved in the conversation. And that's what we teach, is we teach people skills, making sure that you're able to communicate with people, you're able to connect with them, that you're building that relationship and not just having this robotic conversation with them.
What we're talking about here is the difference between being a good communicator and an influential communicator. So yes, with your dental scripting, you can be a decently good communicator. You can find out what's wrong with someone, what their name is, their date of birth, insurance. It can still be a pleasant experience. But when you're an influential communicator, you have this ability to be able to adapt your message and on the fly to whoever you're speaking to in a way that they need to hear it. So you have to be able to understand how the person that you're speaking with communicates and the best way to communicate with them, and be able to adapt that message to them, even if it's for a call in, whether it's for notes in the operatory and seating, but really being able to adopt it in a way that works for them as well.
So if a patient calls you on the phone and they're in pain, are you really going to ask them to go through this step-by-step questionnaire? Are there things that you can skip over? Or maybe they're going to deliver the message really rambled and quickly, and you're not getting all that information. How's it going to sound for you to ask them to repeat their name or go back to this, or I didn't catch that because I need to fill out this paperwork? We really want to make sure that you don't become these robots that are not connecting with people, especially at times when they're in pain.
Now, one example that I see pretty frequently is the patient that calls in and they're giving you the answers to those questions that are on a script for triaging. And it's just not in the order that you're used to receiving them. So you kind of go through in the checkbox order. So say they call in, they're like, hi, it's Chastity, and I was calling to schedule a cleaning. Can you give me your date of birth? 1/8. And can you give me your name? It's Chastity. It really falls down to active listening. I don't want to give away all the tips we're going to go over, but it's just being present, listening to the way that they're communicating with you, being receptive and aware of what the information is that you need to collect, but communicating with them in a way that works for them.
Okay, so this happens all the time. We have a script in front of us and a few things happen to us. First and foremost, we're not fully present. Sure, you're standing there in front of the person or you picked up the phone. That doesn't count as being present. We talk all the time in our videos about active listening. So we need to pay attention. Pay attention to the words that they're using, the tone. If someone sounds like they're crying on the phone because they're in pain, acknowledge that. Empathize with them. It's really important to be that empathetic, active listener and to fully be present and make sure that you're not just reading off of a script and taking yourself out of the emotions and that connection, that human connection that we're really looking for. On top of that, we want to make sure that we are fully understanding. And to do that, we always have to ask open-ended questions, right? And you might have some great open-ended questions that are on your script. Plenty of time, so you could go through that entire script and still have more and wonder more. And if that's the case, being present is going to allow you to make sure that you're asking those questions that are also not on the script. So make sure that you pay attention, you're present, and you ask more questions to understand.
One thing that happens when we're using scripts as well is we tend to forget about what our body language looks like. So if we are sitting and looking at a list at a desk or in the operatory on the computer, we tend to be either looking down and closed off from people, or we might be standing behind the chair, behind the chair, looking at the computer instead of looking at our patient. A big part of being active when we're listening is making sure that our body language is telling that same story. So we can either do a few different things. We can make sure, first and foremost, that we're making eye contact, that our body is positioned towards the person that we're talking to. You can even do a little bit of a head tilt to acknowledge that you're listening. Those are all great ways to show that you are actively engaged and concerned about what it is that they're telling you or what it is that they're trying to communicate to you. The last thing that happens when we're scripting is we tend to focus very inwardly. So it falls down to, what do I need to know? What information do we need for this appointment? What is it that we need to be able to process this appointment? If it's based on insurance, or maybe it's what is going on with our health status that we need to be aware of to make sure that we're following the appropriate guidelines. And we get very trapped in that process. We really have to pause and think outwardly. So what is it that our patient needs from this moment? What is it that they need to know about their treatment that's happening? What is it that's going to impact them? And when we have a list, we tend to default to that and we get very stuck in that. I do the same thing. This is so common. If I have a list in front of me, it's like nothing can deviate from that. So it's making sure that we're at least aware of that and thinking more outwardly.
All right. Boss says you got to use a script. So now what? How are you going to use a script and still connect with your patients?
Tip number 1 is going to be to use it for training purposes.
Yeah.
So really going through rehearsing what it is that you need to be able to say, the information that you need to be able to gather, and really sticking to it just for the training guideline to make sure that you all have it down and that you're all calibrated. Now, tip number 2, put the script away and try it in your own words once you've gone over it. That's really going to stimulate some more creative thinking. It's going to make sure that what you're saying is also authentically your personality as well, because people love that about you because you're you.
Now, tip number 3, once you have memorized it and you are a pro at this script, you really need to make sure that you break it up a little bit, right? Once we memorize something, we become very robotic and we don't sound like our authentic selves. So here's a fun little thing that you can do. Try saying it in different accents. No, not to your patients, not to your team members. No. This is something that you do at home or in the car alone. But if you have something completely memorized, try saying it in different fun accents or languages. If you know other languages, whatever you can do to break it up a little bit, it's going to make it so that the next time you go to say it, it's not going to sound so robotic. So what's this look like? Well, driving in my car right now and I say, "Thank you for calling ABC Dental. This is Christina. How can I help you smile today?" So go ahead and try up to 3 different accents. I am not going to do them all for you and bore you. You can try singing it. Definitely not going to do that one for you. But this will help break you out of that norm. And the next time you go to say it, it's going to sound different.
So we want to know, do you script in your practice? What has your experience been with it? Make sure that you're using these tips and tricks to shake up the way your script is, so then you're at least able to communicate authentically with your patients in a way that is more outward thinking.
Did you like this video? Make sure to give us a thumbs up and do not forget to subscribe to our channel, The Dental MVP.